We've been sourcing personal protective equipment, or PPE, as it's been commonly referred to in the news media. We've been going out to various sources trying to get that type of PPE for our folks for quite a while. When the COVID-19 threat started making news around the world, we have one of our firefighter paramedics, actually our deputy fire marshal, sources a lot of our EMS gear, Chad Tramp, and he's been doing a great job making sure all of our folks are protected. Recently, we've been working with the Office of the State Fire Marshal to make sure that we have plenty of personal protective equipment, and it's been coming from the state stockpile. And we're creating kits for each one of our personnel to use when they're in contact with a potential COVID-19 patient.
Fantastic.
Klamath County 911 is screening calls using CDC guidelines that have been provided for them as a public safety answering point. Anybody that answers 911 calls in the state has been directed to use these CDC guidelines to screen in or screen out COVID-19 or possible COVID-19 patients. We're getting a lot of people with the same symptoms between flu and COVID, and we're not really making a determination on the scene because we don't have any testing capabilities. We're treating all those patients as potentially infectious patients. Our crews are wearing the appropriate PPE and transporting to the hospital for further testing. Morale, as far as the fire department and our EMS service is concerned, is really good. We've been out, myself and a couple of other chief officers have been out educating our staff, making sure that they're safe, they have the appropriate PPE, and that they're getting their information from reliable sources like Klamath County Public Health, the CDC, and other online sources, and OHA. Those are the three that we're using right now. My job right now is to take a lot of the information we're getting from those three sources, digest it down, and give it to them in small bits, enough to keep them safe, keep them informed, and keep their families safe as well. So the more information, the better. We just have to make sure it's coming from the right place. The best thing I can advise people to do is to stay calm, vet your sources of information, and use your local public sources that you have here in Klamath County, and the number one spot for that is going to be Klamath County Public Health's website. Klamath County Fire District 1 is partnering with all of our community health agencies, Oregon Health Authority, Klamath County Public Health, of course, being our sources of information and guidance on how we're treating patients. Sky Lakes Medical Center, we're working in conjunction with their ER department, and our medical director, Dr. Jake Freed from Sky Lakes. We're working with Keno Fire Department, Chiloquin Fire Department, Klamath County Fire District 4, Rocky Point, Bonanza Ambulance Service, Basin Ambulance Service, all the way up to Crescent, Chemult. All the EMS agencies are working together to make sure that each agency has the appropriate amount of PPE that we need to treat our communities effectively. And we're getting some of that equipment from the state. The equipment's all coming into a central point, and we're distributing it out from there based on local need.